Welcome to the Pharmacology Series, where we dive deep into the essential concepts of pharmacology to equip you with a solid understanding of drug mechanisms, applications, and clinical relevance. In our previous video, we explored pharmacodynamics, detailing how drugs interact with their targets to produce effects. Today, we're shifting focus to drug metabolism. By the end of this video, you'll gain a thorough understanding of drug metabolism and its real-world implications, such as its influence on drug efficacy, safety, and individual responses. Don't forget there's a separate video with a quiz featuring 10 multiple-choice questions on this topic. You can find the link in the description below. By the end of this video, you'll understand the significance of drug metabolism in pharmacology. Phase 1 and Phase 2 reactions with examples. The role of enzymes and transporters in metabolism. How factors like genetics, age, and disease influence drug metabolism. The concept of toxic metabolism and its implications, such as paracetamol overdose. Clinical applications, including prodrugs and drug-drug interactions. Drug metabolism plays a crucial role in converting lipophilic drugs into water-soluble metabolites, ensuring their effective elimination from the body. Without this process, drugs and toxins could accumulate, leading to harmful effects. Remarkably, over 50% of drug-related hospitalizations are tied to adverse drug reactions, often influenced by individual variations in metabolic pathways, underlining its critical importance in clinical practice. Codeine metabolism is a classic example of how genetics influence drug response. It relies on the CYP2D6 enzyme to be converted into morphine, the active compound responsible for its pain-relieving effects. However, genetic variations mean that some individuals metabolize codeine too quickly, leading to excessive morphine levels and potential toxicity, while others metabolize it poorly, resulting in reduced efficacy and inadequate pain control. Phase 1 metabolism involves chemical reactions like oxidation, reduction, or hydrolysis that add or expose polar groups on drugs, preparing them for further processing. Phase 2 metabolism enhances this by conjugating drugs with polar molecules such as glucuronic acid, increasing their water solubility. Together, these phases optimize drugs for efficient excretion through urine or bile. Oxidation, the predominant phase 1 reaction, is primarily catalyzed by cytochrome P450 (CYP) enzymes, which modify lipophilic drugs into more polar metabolites for excretion. Oxidation reactions chemically alter drugs by adding oxygen or removing electrons, increasing their polarity for easier excretion. For example, the sedative diazepam undergoes oxidation to form nordiazepam, an active metabolite. The other two major reactions in phase 1 of drug metabolism are reduction and hydrolysis, which also modify drug molecules to make them more water-soluble and easier to eliminate. Reduction adds electrons to drug compounds, as seen when chloral hydrate converts to trichloroethanol. Hydrolysis, on the other hand, breaks ester or amide bonds, like when esterases split aspirin into salicylic acid, facilitating the drug's removal from the body. In general, these reactions increase solubility of the drug, thus enhancing elimination. Phase 2 reactions, also known as conjugation reactions, are essential in drug metabolism. In this phase, enzymes attach polar molecules to drugs, transforming them into water-soluble metabolites that the body can easily excrete through urine or bile. This increased solubility helps in rapidly clearing drugs from the system, reducing toxicity, and prolonging the safety of drug usage. Conjugation reactions thus play a vital role in the body's detoxification process. Some of the key processes in phase 2 reactions includes glucuronidation, sulfation, and glutathione conjugation. Glucuronidation, for instance, helps metabolize drugs like paracetamol via UDP-glucuronosyltransferase. Sulfation plays a role in the metabolism of drugs like minoxidil. Glutathione conjugation is an essential phase 2 reaction in drug metabolism, where toxic compounds like NAPK, a harmful byproduct of acetaminophen metabolism, are neutralized. In this process, glutathione attaches to electrophilic molecules, making them less toxic and more water-soluble. This conversion helps protect liver cells from damage, particularly when faced with potentially dangerous substances. Without adequate glutathione, harmful electrophiles can accumulate and lead to serious liver injury. Cytochrome P450 enzymes, commonly referred to as CYPs, are essential in drug metabolism. Among these, CYP3A4 is responsible for metabolizing nearly half of all prescribed drugs, highlighting its central role. Variations in another enzyme, CYP2D6, can significantly affect the conversion of medications like codeine into their active forms, influencing their therapeutic effects. Drug transporters, such as P-glycoprotein, are crucial in moving drugs out of cells, impacting drug effectiveness and safety. In chemotherapy, these transporters can create resistance by actively expelling drugs like doxorubicin from cancer cells, reducing their therapeutic impact. Understanding transporter function is essential for improving drug efficacy, particularly in challenging treatments like cancer therapy. Drug metabolism is influenced by several key factors that affect how drugs are processed and eliminated in the body. Genetics, for instance, plays a significant role, as variations in enzymes like CYP2C19 can impact the activation of certain drugs, such as clopidogrel. Age also influences metabolism. Newborns have underdeveloped enzyme systems, while older adults may experience decreased liver function, which reduces drug clearance and can lead to accumulation and potential toxicity. Drug interactions significantly impact drug metabolism, especially through enzyme inducers and enzyme inhibitors. Enzyme inducers, like rifampicin, can increase the activity of enzymes, leading to faster drug metabolism and reduced drug effectiveness. On the other hand, enzyme inhibitors, such as ketoconazole, slow down enzyme activity, resulting in higher drug levels and potential toxicity. Understanding these interactions helps in predicting and managing drug responses and avoiding adverse effects in patients. Liver disease significantly alters drug metabolism by impairing enzymatic activity, leading to reduced clearance of certain drugs. For instance, lopinavir, an antiretroviral medication, relies on hepatic enzymes for metabolism. In patients with liver disease, lopinavir levels can rise, increasing the risk of toxicity and necessitating dose adjustments or alternative therapies. Paracetamol is primarily metabolized in the liver via glucuronidation and sulfation pathways. However, a minor fraction undergoes CYP450-mediated oxidation to form N-acetyl-P-benzoquinone imine, NAPQ, a toxic intermediate. Under normal doses, NAPQ is detoxified by glutathione conjugation, but in overdose, glutathione reserves are depleted, leading to hepatocellular necrosis. N-acetylcysteine, a precursor of glutathione, is the cornerstone of treatment, restoring glutathione levels and neutralizing NAPQ toxicity effectively. Lastly, we want to look at the role of drug metabolism on prodrug activation. Prodrugs are pharmacologically inactive compounds requiring metabolic activation to exert their therapeutic effect. For instance, clopidogrel is a prodrug bioactivated by hepatic CYP2C19 enzymes into its active thiol metabolite, which inhibits platelet aggregation. Understanding prodrug metabolism allows clinicians to optimize drug efficacy, minimize interindividual variability due to genetic polymorphisms, and improve safety, especially in patients with compromised enzymatic activity or co-administered enzyme inhibitors. Now that we've explored drug metabolism, let's take a moment to recap. We've covered the importance of drug metabolism in efficacy, safety, and therapeutic outcomes. Phase 1 and 2 reactions and their role in drug solubility and elimination. Key enzymes like cytochrome P450 and transporters like P-glycoprotein. Factors affecting drug metabolism, including genetics, age, and disease. The concept of toxic metabolism and its clinical implications, like paracetamol overdose. Practical applications, such as prodrugs, drug-drug interactions, and therapeutic monitoring. In conclusion, understanding drug metabolism is essential for predicting drug effectiveness, potential interactions, and risks of toxicity. By recognizing how factors like genetics, age, and enzyme function impact metabolism, we can better anticipate clinical outcomes, ensure safer prescribing practices, and optimize the therapeutic use of prodrugs. In our next video, we'll explore pharmacogenomics, focusing on how genetic variations affect individual responses to drugs, aiming to personalize and optimize drug therapy for each patient. For further reading, explore Clinical Pharmacology by Katsung and Trevor, Rang and Dale's Pharmacology, or consult BNF guidelines for comprehensive pharmacology insights. If you found this video helpful, give it a thumbs up and subscribe to our channel for updates on this series. Share your thoughts or questions in the comments, I'd love to hear from you. Pharmacology is a journey of continuous learning.
Thank you for watching. I look forward to seeing you in the next video on pharmacogenomics.